In today's episode, we'll explore the difference between counselling and psychotherapy and how those terms are used in practice. These two words are often used interchangeably. Many people assume they describe the same thing, while others believe one is more serious or more intensive than the other. The reality is more nuanced, and understanding the distinction helps clarify how different forms of therapeutic work are positioned. Historically, the term psychotherapy emerged first. It was used to describe psychological treatment that focused on emotional and mental processes, often influenced by early psychoanalytic thinking. Counseling developed later as a distinct practice, particularly in educational, community, and well-being settings. Over time, the boundaries between the two have become less rigid. One way to think about the difference is in terms of emphasis rather than depth. Counseling has traditionally focused on supporting people with life challenges, transitions, and decision making. Psychotherapy has often placed more emphasis on longer term patterns, personality development, and the influence of early relationships. That distinction can be helpful, but is not absolute. In modern practice, both counseling and psychotherapy can involve short term or longer term work. A counselor may work in depth, and a psychotherapist may work in a focused and time limited way. The title alone does not determine the nature of the work. This is why two people seeing different practitioners with different titles may have very similar experiences. Another way to understand the distinction is to think about how the work is framed. Counseling is often described as working with difficulties that arise in the context of everyday life, whereas psychotherapy is more often described as working with internal processes and long-standing patterns. When you hear those descriptions, which one sounds closer to what you imagine needing? Support with current life issues or exploration of deeper patterns over time? Training routes also influence how these terms are used. In the UK, counsellors and psychotherapists often train through different professional pathways, even when they work within similar therapeutic approaches. Psychotherapy trainings are typically longer and may place more emphasis on personal therapy, theoretical study. Counselling trainings may be more focused on applied practice and accessibility. Both routes involve rigorous standards and ethical frameworks. It is also important to recognize that different countries use these terms differently. In some contexts, psychotherapy is a protected title. In others, counseling is the more common descriptor. This can add to confusion, especially when people are searching for support online or reading international resources. In practice, what often matters more than a label is the approach being used and the relationship with the practitioner. A counsellor and a psychotherapist trained in the same model may work in very similar ways. Conversely, two practitioners with the same title but different orientations may offer very different experiences. This raises a useful question. When choosing support, is it more important to focus on the title or on how the practitioner works and what approach they use? Many people find clarity by looking beyond labels and paying attention to fit, style, and orientation. Counseling and psychotherapy are best understood as overlapping fields rather than separate categories. They share common foundations, ethical principles, and aims. The difference lies more in tradition, training emphasis, and professional identity than in the quality of seriousness of the work. Understanding this distinction helps reduce unnecessary hierarchy. Neither counseling nor psychotherapy is inherently more effective or more legitimate. They are different ways of organizing therapeutic work within a broad and evolving field. In the next episode, we'll build on this by exploring the difference between counseling and psychology and how therapeutic work differs from psychological assessment and research. That's the scope of this episode. Each episode focuses on one specific element, and this was it. We'll leave it there for now and move on in the next episode.